And Paul, just to check, you can only see the slide, right? You cannot see the side. Yeah, okay, great.
Yeah, we're now live, Louisa.
Thank you.
Welcome, everyone. We're just letting you all in, so it'll take a few minutes to get started. Do say hi in the chat should you want to. Don't feel you have to. We can get started. I expect other people may be joining as we start, but let's just crack on. So welcome everyone again. My name is Paul Harvey. I'm the co-director of the Basic Research Programme, which stands for Better Assistance in Crises, led by IDS and funded by FCDO. And today we're having gathered together for a webinar on reframing the accountability of social assistance in crisis with a great group of discussants and panelists. Louisa's going to kick us off, and then we're going to move to our discussants, Alex, Dana, and hopefully Naomi has been having some audio problems, but we're desperately trying to fix it, so fingers crossed. Louisa, with apologies, I'm forgetting if I meant to introduce the discussants now or if I'm handing over to you, so I might hand over to you and you can tell me.
You can hand over to me and then we'll introduce our speakers. Hi, everyone. My name is Louisa, and I've been working with Paul and other colleagues on the Basic Research Programme on the accountability of social assistance in crises. And so I think most people on this call are working on, in some way, on accountability. But just to kind of frame the discussion here, when we're talking about the accountability of social assistance, we're looking across kind of humanitarian accountability to affected populations, and social accountability, so looking at the relationship between duty bearers like the government and communities affected by crises, and trying to understand how programs that provide social assistance to meet basic needs, whether it's cash, in kind, part of social protection or humanitarian response, how they are listening to, providing feedback and information to, and adapting programs based on people's feedback. And so what I'll do is I'll give you just a brief overview of what we did recently with Paul in our global overview, and then, of course, turn it over to our esteemed speakers. We're trying to do something a bit different. I think we've been talking about accountability for decades. People know the challenges, but what's really exciting today is that our panelists are going to talk a bit about how they maybe failed at accountability, what they learned from it, and what gives them hope for the future. Then we'll open it up to all of you for questions and comments before Paul closes it out. So I'm not going to go through everything, and of course this can be shared. Unfortunately, I don't think you can see the link here, but we just updated the global review. So looking at all the evidence across social protection and humanitarian programs that are available to look at what accountability really means in crises to provide social assistance. And I think a lot of these challenges are going to be, unfortunately, very familiar to you, but just to kind of help structure the discussion, we're still seeing a lot of fragmented systems. So accountability is limited to programs or projects, and those specific feedback mechanisms often create confusion, especially if people are trying to access information and they haven't been selected as recipients. And similarly, this idea of top-down design that aid and social assistance in crises has to be designed by experts means that we're continuing to see a lack of community voice in the way these programs are designed and how feedback is collected and how accountability is conceptualized. So even though there's a lot of focus on inclusion, marginalized groups, because their participation is layered on kind of local and contextual power imbalances, they're still facing a lot of barriers to participating and understanding what aid is available to them. And so they often are excluded from decisions about the assistance they're meant to receive. And finally, the kind of third overarching challenge is around these competing program priorities. So rightly so, in this environment with limited funding and the need to demonstrate quality programming, donors are leaning towards these zero tolerance policies when it comes to corruption and fraud of aid. But what that's doing on the ground is it's limiting the conversations that aid providers and communities feel comfortable having if they feel that they might be penalized. For example, in Somalia, talking about gatekeeping from local leadership that might be taking a percentage of the cash assistance. And in particular, the technical targeting that's a big topic of discussion around the bigger social assistance programs in crisis areas like Iraq means that it's competing with local concepts of fairness and who should be included. And finally, we're seeing this proliferation of digital solutions. I think we're all kind of annoyed with the integration of AI on everything, even though it brings a lot of benefits. And what we're seeing is that there's a focus on those tools and not necessarily what the tools should be doing, which can further exclude certain groups. Now, it's not all gloom and doom. We've got a lot of promising practices that are coming out. So this idea of integration, taking a kind of government-led approach and embedding accountability in local systems, even if those systems need improvement, strengthening, adapting, and that tends to resonate more with communities and produce better outcomes in terms of providing information, seeking feedback, and making sure that programs really reflect people's priorities. We're also learning a lot more from community-driven solutions, which have always been there, but often operate in parallel to formal systems. And so mutual aid, solidarity-based networks are showing us, again, real-time examples of how accountability can be a conversation, not just we get a ticket, we respond to a complaint, and we close that feedback loop. We're also seeing a lot more of the development style social accountability tools. So things like social audits, where communities can hold the formal or institutional aid providers accountable, popping up in crisis settings. And finally, this trend towards making sure that frontline staff have those conversations and feel empowered to take that feedback and to adapt programs. And then finally, there's a whole discussion around humanizing that technology. So making sure that digital tools remain tools. They're not replacing human contact, they're amplifying it. And so a lot of these multi-language, multi-channel platforms like Talk to Loop in Somalia are enabling different groups to participate. So in this complex landscape that many of you are very, very familiar with, we'd like to introduce our speakers. So Paul, over to you to tell us who's going to be sharing their experiences today.
Thank you. So I was just tapping in the chat. For some reason I can't chat to everyone. So if I'm not responding to you in the chat, that's why. I know, Louisa, you've done embarrassing headshots of everyone except yourself, which seems a bit unfair. So Louisa is a researcher and consultant with ZEBS and independently and working with BASIC. Naomi is the executive director of CapAid Uganda, an NGO implementing humanitarian and development programs in Uganda. She's also the coordinator of the local coalition Acceleration Uganda, hosted by CapAid, a group of local NGOs that includes refugee-led and disability-led organizations. Dana is the director of Paswan, an Iraqi civil society organization based in the Kurdistan region of Iraq, dedicated to tackling societal challenges. In addition to his work on social policy and information ecosystems in Iraq, Dana led Paswan's collaboration with the Basic Research Programme for participatory research on lived experiences of people receiving aid in the KRI, which we should also post a link to in the chat, and the accountability research with frontline providers of social assistance. And Alex is the manager of community engagement and accountability at IFRC, Red Cross and Red Crescent Society. She leads the Federation's work on communication with crisis-affected communities and accountability initiatives, notably the Community Trust Initiative. So thank you to all for joining. I hope you haven't had to take time out from the Afghanistan earthquake response, Alex, which I know the Federation is very involved in. And back to you, Louisa.
So maybe we can start with Alex, but what we wanted to do here is a kind of failure fair. So being very honest about all these years of accountability work that your organizations have been doing. Tell us a little bit about how you tried to strengthen it, maybe what didn't work and what you learned from that along the way, and how you adapted. So first over to you, Alex, and then we'll hear from Dana and Naomi.
Thanks so much, Louisa. And first off, congrats to you and Paul for such a great report. Couldn't agree more with all of its content, and it's so needed to continue reflecting on these issues. For us at IFRC, obviously, with our national societies worldwide, we've really invested in community engagement and accountability approaches in the past probably decade. Things have evolved a lot. But we've noticed that, generally speaking, and this is sector-wide, there's an overemphasis on community feedback systems. So that you set up a feedback system and it equals like, perfect, you've done your job in terms of accountability. When we know, of course, that real accountability, real participation goes far beyond setting up a hotline or a suggestion box. For instance, about hiring and training the right people, collecting, analyzing community insights at scale, and especially ensuring continuous dialogue to make real changes in the way we operate. The fail-fast example I'm going to give you today was quite interesting because of this overemphasis on feedback, we really wanted to try something different in terms of true community participation. So in Mozambique in 2019, in the response to Cyclone Idai, of course, affected communities really wanted to go home immediately after the cyclone to start rebuilding their houses, restore livelihoods, etc. So we really seized the opportunity to adopt like an innovative approach to prioritize community-led recovery. So we engaged communities to directly participate in the design, the implementation, the monitoring, and really looked at what the IFRC network could provide for people's recovery. So it was quite exciting because in a lot of ways we did many, many things right. Leadership in country developed a long-term recovery plan. We allocated enough funding for the effort. Staff generally supported the approach. We had community buy-in, etc. But of course, along the way, challenges emerge. And I think it's reflective of a lot of systematic issues we have in the humanitarian sector and how our organizations are structured. So really, I don't think this is unique to IFRC or the Red Cross Red Crescent when I think about these challenges. So first, of course, what happened is that along the way, there's a lack of clarity around budget, and especially procurement capacity. And then we had, of course, a high staff turnover because that's the case in most, sudden onset type of emergencies. So eventually this led to overcommitment and under-delivery to communities. So for instance, in terms of procurement issues, like things stalled in terms of construction, and we couldn't purchase seeds and fishing nets quickly enough. So communities, they became frustrated with the delays and missed like really critical planting and fishing seasons. Then, of course, the fact that the staff turnover meant that the team didn't really have the ability to effectively plan and implement the program on the long term. And essentially, with the staff turnover, there was a decision to really meet donor requirements and operational timeframes. So we ended up pushing to take a quantity over quality approach to really demonstrate tangible outcomes as quickly as possible. So of course, this created a lot of confusion and frustration within the community. We lost a lot of trust, right? It just shows that, true community participation takes time and engagement, and that's something we need to be ready for from the get-go, right? And just to finish with the fact that in your report, you mentioned that accountability initiatives continue to be too narrowly project specific. And often, of course, accountability efforts often are limited and focused to direct aid recipient and neglect kind of wider community, civil society, and other stakeholders. And I think that's a really important statement. And for us in this kind of failure example of Mozambique, where we really set the layout for all of this, I think the problem also is that it should have happened way before the emergency, right? And often that's the thing, is that we set up these systems, we try to innovate in the middle of an emergency because that's where we have the funds for it, right? But really it's all about preparedness, and these things should have already been put in place so that we didn't, face these kind of shortcomings. So having said that, even though this has been really essentially a failure for us in terms of our community engagement approach, it really brings a lot of learning. And that's why I hope we can document these kind of failures more effectively. But also, I think it was Ben Parker who said that if you don't feel uncomfortable, then you're not being accountable. And we need to be ready to feel uncomfortable. And it is, we need to take more risks. And so in this case, we took that risk. It didn't go as well as we had hoped, but that's okay, right? We need to now learn from it and continue to feel uncomfortable and make these uncomfortable decisions in the future as well. So that's for
Great, thank you. And I think that quote is so apt for exactly the environment that we're finding ourselves in. Dana, I'd like to turn to you and tell us a little bit about Pasawan's work and some of the failures and learnings you've had as a civil society organization based in the Kurdistan region of Iraq, where you've been building these relationships for years now.
Yeah, thank you, Lisa. Hello, everyone. Actually, in our project in partnership with IDS, we started by several steps. First, a study on lived experience, then accountability research, and also managing a campaign on Protect My Dignity. Now we are working on a legal reform concerning social protection in Kurdistan region of Iraq and the whole Iraq. From our basic research, we found that social assistance was scattered and uncoordinated. For example, different organizations supported the same people without knowing it, and while the others couldn't receive any help. And also there were some places was covered by assistance, but the other places were ignored. Through our activity also, we worked to bring the social assistance providers together through a shared central database. For this purpose, we held several meetings with the NGOs, and the government institutions. In addition, Pasawan, in partnership with IDS, we produced 2 research and prepared 2 policy papers in both Kurdish and English. In our work, we also discovered the informal providers, individual and businesses working outside any rules. They often expose recipient identity by posting their photos and videos in the social media to boost their own image. We found this is a kind of privacy violated and dignity. To respond to this, we launched, as Pasawan, we launched a campaign on the name Protect My Dignity to raise awareness. So what we learned through this process, the first thing we learned, the authorities, the government institution had no any connection with the informal providers, as I mentioned. And also we found there is a big gap in the legal framework. Too many overlapping laws created confused and left room to abuse. We decided to push for legislative reform by merging the separate laws into one strong, clear law that closes those gaps. Now we have a set of recommendations ready to present to Parliament, government, and UN agencies. Also, we found significant overlap among social protection laws, for example, skills laws in Iraq and skills laws in Kurdistan region, with major differences in practice. For example, the Iraqi laws focus on the poverty line in social protection, while the KRI laws targeted the marginalized groups. We also identified gaps in the law, social protection laws in KRI and Iraq. It's like there's no article about transparency. There's no mentions for the protection of dignity. There's not a regulation for managing of informal assistance and equal access to social assistance. Yeah. Do you have any question?
Thank you. We'll get to those questions. And I think especially having worked now with Pasiwan for a couple of years. I think you really encapsulate this idea that when social assistance programs are coming into a crisis-affected place, there's a lot of ignorance around what legislation already exists, how informal aid, which is perhaps not as principled or well-designed, even if it's well-intentioned, kind of goes by the wayside. But for people living that crisis, it may be the only social assistance they can access. And I think your point also about the exclusion of civil society organizations that can build some of the trust that Alex was mentioning are not included in a lot of these reforms. It's really great to see that. So I'd like to turn over to Naomi. You can tell us a little bit more about how local organizations in Uganda are taking back that power and space and what you've learned about accountability along the way.
Thank you, Luisa, and thanks to the former speakers. As CAP AIDS Uganda, we focused a lot on making ourselves as local and national actors better stewards to humanitarian and development aid in terms of ensuring that we have the capacity, because the song has been sung for long that local and national actors don't have capacity. Now, as far as social accountability is concerned, it's actually legally instituted in our mother legal framework. Unfortunately, the learning that we have over the years that we've been serving is that accountability for affected persons is still the flavor of the time, rather than it being practical. It aligns to what Luisa just said, that if we are to say that it's about listening and providing feedback to the affected person, it's still far from reality, from our learning. In practice, the skills are meant to foster meaningful community engagements with key stakeholders, key aspects involving understanding the voices of the affected persons, improving feedback mechanisms, and integrating the principles into decision-making to ensure more relevant and effective aid. However, in our experience, the learning is that it is still far from reality. A quick survey, we are the national convener of the local leadership labs, that we started with just listening to local and national actors and the last mile communities into what do you think should be done for your respective communities in terms of humanitarian and development aid. And out of that, out of the 200 local and national actors that we interacted with, 10% of the local actors could not disclose the relationship they have with the donors that they are working with. And yet about 16% reported that they're having a master-servant kind of relationship. Now, this shows the inferiority complex they have and their inability to engage with the funder. It also is also possible that they could be implementing donor-imposed activities. Now, if the relationship is up to that level, how then do we think accountability is being realized on ground? It is still far from reality. That is a major learning for us as CAP AIDS, who are trying to put together the local and national actors. However, we also see that there's a yearning by the last mile communities, there's a yearning by the local and national actors to be engaged, to share their expertise, to share their knowledge. However, there is no platform. And even as local and national actors, when you have the expertise, you have the knowledge, you have the information, it is not considered as high value information. If you produce a research like we now have, it will not be prioritized. And yet this research is coming from the last mile communities. So the endeavors are there in the community, but the realities are still far-fetched from what we can think in terms of accountability for the affected persons. And as Alex said that if you don't feel uncomfortable, then you're not feeling, then you're not being accountable to the community. So our research showing the master-servant relationship is an example that we are relying so much onto the donor regulations and not prioritizing the voices of the local and national actors and the last mile actors who are the communities, especially in the community in Uganda where we have over 1.9 million refugee communities, and the influx this year is higher than the last 3 years as presented in the latest comprehensive refugee response framework steering committee meeting that we last had. So it's still a challenge. And it involves a lot of recommendations. It involves a lot of work as recommended in Luisa's report, where she says accountability. I think Alex mentioned it, that accountability that is on ground is project specific, and they neglect the wider community. I think this is the true reality of the situation on ground, that we need to, and such webinars are really critical because it enables us to bring the reality on ground into the global space, but also together come up with solutions that could change the norm. Rather than waiting for long, we can get started to change the norm in terms of community-driven solutions, in terms of believing in locally led data and information, believing in the value of the last mile communities who are affected when disaster or humanitarian crisis strike, but also working from a partnership perspective where we look at the community as contributors to solutions, not beneficiaries, or not as people who are only receiving support, but look at them as a source of expertise, a source of knowledge, a source of information, a source of structures that can drive that can drive locally led social accountability mechanisms so that we can realize it. We've also learned that the government is actually ready to be part of these processes. But in our research, in one of the communities, like it's one of the, in Karamoja region, where it's one of the communities we look at in Uganda as the least civilized community of Uganda, we engaged with the local leadership, and this is the government structure. And in her communication, she said, this is the first time we are being engaged to design how a humanitarian response or locally led development can be done in our community. We are always looked at as agents or a platform for signing memorandums of understanding with actors. So it is a clear example that even the local government structure, which should be utilized for driving social accountability, is only utilized for entry into the community, such that when the actors get into the community, then they forget about them as a structure for accountability. So if a government structure, a local government structure, that should be the channel for accountability to its community, is only used for MOUs and never engaged in design, implementation, monitoring, corrective action, and so forth, then it becomes challenging in terms of even a social accountability. So this is something that really needs to be drummed up if we are to achieve transformative locally led development and humanitarian response. My last comment is the learning. Another learning is that we have many local and national structures that are in existence that can be used for social accountability, but have intentionally been ignored. These are local structures that are closest to the community, that listen to community day and day, but they have been utilized for mobilization purposes, and it ends at mobilization. And this speaks, I think, to the research that Luisa shared with us, that we don't engage the wider stakeholders, the wider community, but we only engage them for our own interest, but not necessarily social accountability. So the structures are on ground, but we engage them for our own interest, but not for social accountability. And that's why our learning is that it's still an area that needs to be talked about. It's still an area that awareness creation needs to be made. It's an area that the principles of social accountability are clear, but they are not followed in practice. Over.
Yeah, what you said about the locally led data not being taken seriously or not given a high value, I think resonates with a lot. And staying with you, Naomi, maybe just a couple of words about what keeps you motivated, because those findings are fascinating. They're also a bit depressing. And a lot of local organizations around the world have been sounding the drum as you have. So I'm just wondering if you could just say a couple words about what you see as the future. You mentioned about communities being seen as structures for social accountability, structures for accountability to affected populations.
Thanks. What keeps me motivated is, as the leader of the National Humanitarian Platform in Uganda, we are going to continue drumming the organized noise about the need to recognize local infrastructure, local structures, the communities that are affected by disaster and humanitarian crisis as central in response and social accountability. And also keep on drumming this to be included, being part of the National Humanitarian Platform and being recognized as local leadership that has information in the country. Will you exploit that opportunity to drum the need to recognize the role of the last mile actors and the role of the community in humanitarian response, locally led development, but also in social accountability. And we will utilize all the platforms that we are having leadership in, because I believe that innovation is not the very complicated high-tech, the very complicated ideas that are sometimes not feasible in a local community in reality. Innovation is appreciating and respecting local leadership and utilizing their expertise to transform social accountability, locally led development, and humanitarian response. Over to you.
Great. And I think what I love about your answer as well is that you're answering the question, well, it's too complicated to engage with the different groups. There are national aggregators, accelerators that exist, like CapAIDS and the locally led initiative. Dana, over to you, a little bit about what you and Pasewan see as the future and what keeps you motivated in Iraq.
Yeah. Really, there are many points we can talk about it, but for the future, I think there are three of them is very important for Kurdistan region and Iraq. The first one, the international NGOs should work with the local NGOs from the project design to delivery, because local NGOs know their community and they can act effectively and they can do the project with the low cost. Second, if the international organization, local NGO, and local government can plan together, they can make sure the aid will be fair, effective, and sustainable. Besides this point, drafting a new law for reorganizing social protection in all Iraq and KRI will be the most important point, but this law must be based on the international standards. About the motivation for continuing social assistance and progressing this situation, we found many honest people during the crisis, especially, and when the government failed. We found many honest people in our communities care deeply about each other's welfare. Like they step in when the government failed. For example, during the COVID-19 pandemic, the community will support each other very well. And recently, because of the conflict between the KRI and Iraqi government, for example, around 3 months, the employee couldn't get salaries. It's like the local community, they like take care for each other. They were aware about the other life and they give a hand to each other. This is a good motivated, but it is not organized. That's why we mentioned through the legal reform, the informal assistance must be organized, because maybe sometimes it will be violated to another way. Also, beside that, local organization with limited resources always support the vulnerable groups. Local business also sometimes do what they can to do to support people. These points are good motivated, I see, inside the society, but they need supported by allow and the government to organize it.
Excellent. And I think what's really interesting about what you're saying is that it's hard to find two countries that are so different than Uganda and Iraq, but the commonality there is you're talking about creating a networked approach and making sure there's a framework, legal, policy-wise, platform-wise, to be able to structure those voices and come in with a principled approach. Last but certainly not least, Alex, you want to tell us a little bit about what keeps you motivated and what you think and IFRC thinks it would look like if crisis-affected communities finally drove the decisions about their own assistance?
So much, Lisa. I mean, yeah, I've been working on this topic for way too long, so it's very easy for me to be cynical. So when I feel cynical, I try to sit back and think back at where we were 10 years ago, plus when I started working on this. And a lot has been done, you know, a lot of practice, a lot, you know, I think I like quoting people today for some reason. Sorry for that. But I think it was Nick Van Praag who said that we won the propaganda war when it comes to accountability. I mean, I think Naomi said this, you know, we talk about it a lot, but we're not yet there. So yes, we won the propaganda war, but now it's about actually doing it practically. So so that's, you know, that's what keeps me motivated in a way that we've come a long way, let's say, in the past decade, but there's still a lot to do. I think, of course, the current humanitarian reset is a huge opportunity. Often when, you know, we're forced to change things, sometimes we don't always make the best decisions. But in this case, I'm pleased to see that accountability is, you know, a core component of the discussion. Then it's really how do we get together and, again, as Naomi said, make it practical and tangible. For us at IFRC, especially in terms of social protection, we're really kind of rethinking how we're looking at this area of work, especially around accountability. I think Paul mentioned, of course, that our national societies have a unique role as auxiliary to government and can become that link, right, between communities and authorities. Of course, governments are the primary duty bearers when it comes to social protection, for instance, but we're really working with our national societies to support communities to claim their rights, their social protection rights, to support existing community-based mutual aid, community cash grants. And so that's something that we're really looking into more and more right now. And we're also going through our own reform within the Red Crescent Network, but looking at how can communities drive decisions in terms of how money is spent. So we give communities the money and decide themselves how this is spent. It can be risky, of course, as I said earlier, but I think this is a risk we are hoping to take, and we need to ensure we have that appetite. For us, for instance, you know, we've really invested in the past couple of years in understanding what drives community trust and really delving into community intelligence. I don't like the word intelligence, but I think, you know, you understand what I mean by that, you know, to really grapple with communities, the information that communities have, and for us to not only think about what if communities trust us, but also look back and do we trust communities, right? Do we trust communities in the way we work? And that requires a mind shift, of course. And so we're hoping really that these kind of initiatives like community cash grants can really like shift that thinking a little bit and put more trust into the communities and really being able to lead their own lives, of course. So for us with the Community Trust Index, we're still looking a bit too much possibly at how communities trust us and what are the drivers of this trust, but perhaps we can start looking at, well, how do our humanitarian organizations also act towards communities and how does that influence the way we work? And so we're really looking now at key dimensions of trust across formal and informal social protection initiatives as well, so that understanding that community intelligence can drive, you know, how we do social protection better. And just quickly before I finish, so far a lot of the data we have collected on the Community Trust Index, no matter the context, no matter if we focus on urban or rural areas across the board, and the probably 12, 15 national studies where we've piloted this index, we really noticed that two components was really low, and it was trust in terms of transparency and neutrality. And I think this is, again, not unique to the Red Cross, Red Crescent. I think generally the humanitarian sector is not transparent enough We don't, we're not honest enough with the people we serve in terms of our shortcomings, in terms of what we can do, what they can expect from us. And that's why we're afraid of accountability systems, because we're afraid we can't deliver what communities want. But it's also a responsibility to manage expectation and be transparent what we can and cannot do, and when things don't go as planned. And that's how we can, of course, influence that trust and be better at what we do. So just to finish that, I think we really need to think a little bit more on how we invest in that, in terms of really how neutral we are, how fair we are, and as well how transparent we are. Over.
Great. Thank you so much to all three of you. I feel like you're mutually reinforcing, but coming from very different perspectives, which is always refreshing to see. We're going to start now with the Q&A. You can either use the chat or the Q&A function. This is where accountability and action. So your participation is by your preferred method and channel. And I see Caroline has started us off on the conversation, and Paul has not so subtly nudged me to start us off. I'll go ahead and give a brief answer to that. If any of the speakers, maybe Naomi, you'd like to come in and speak a bit about the digitalization, because I know Uganda has been the focus, for better or worse, for a lot of digitalization pilots. Yeah, so what we're seeing is this backlash. The pendulum swung in the last few years to really trying, for example, to harness AI chatbots or WhatsApp to be able to communicate and get feedback, get people to register for social assistance in crises. What we are seeing from local actors is that a lot of them are using technology, and there's a whole section in the paper about social media when we're talking about the KRI, which I think, Dana, you can also reflect on, that has this double-edged sword. On the one hand, it is a great equalizer where they can reach people, local organizations can reach people and be proactive about and visible about their assistance. And they can also raise funds. There was an incredible quote from our work in the KRI of a local organization that in 72 hours was able to raise almost $90,000 for a particular case, money that's just not accessible. But one of the issues is then it comes at a price. And so in KRI, as Dana was saying, people receiving that aid who participated in the lived experience research were talking about how it really affected their dignity. There was not a lot of dignity and choice, and they felt kind of forced for that. So I think one of the things about being proactive and less reactive is embracing the spectrum of more formal to informal. So it's not just about the UN run or the government run programs, but looking at who is touching the lives of and interacting with communities, and being a little bit more kind of forthcoming about those dynamics that Naomi was mentioning, this master-slave, master-servant you used, analogy is something that a lot of local organizations wish that they felt more forthright to do. But touching also on what Alex was saying, there is, unfortunately, because of the political climate around the world, because of the narrowed funding, there's less of a risk appetite to be able to talk about those uncomfortable conversations. And so I think that there is actually a role that digitalization can play. We're seeing, for example, the ability to anonymize and analyze huge amounts of data quickly that can enable local organizations to be more proactive and to speak out without putting particular communities or organizations at risk. Naomi, I don't know if you have any thoughts on that. And then maybe, Dana, you want to talk a little bit about what you've noticed in the KRI for social media.
Thanks, Louisa. I can't see the question here, but I guess it was in relation to localization and technology. Yes, thank you. So Uganda has been taking a lead in the localization agenda, especially being very active in Charter for Change, Working Group Uganda, and then the global, okay, I saw it, Paul, thank you. And also being very active in both the national, regional, and global initiatives that are driving the localization agenda. We are now trying to look at, can localization move away from simply refugee response to also looking at disaster and accountability, which is really critical. And as far as technology is concerned, can we also look at technology that is user-friendly to the communities that we serve, if we are talking of serving, response, and social accountability? And those are the last mile communities. So simple tools like WhatsApp have been utilized for mobilizing resources for quick responses where we have disaster hitting our communities. We are prone to various disasters in our communities, from flooding to climatic issues in various communities of Uganda. And simple tools like simply WhatsApp has been utilized for mobilizing resources. And two, another issue is how organized are we if a pool of resources can be mobilized? And this goes back to the issue of trust. Right now, a lot of partnership mechanisms are more from contractual basis and more of risk-based approach rather than a trust-based approach. So a lot of the funding that was fundraised, for instance, during COVID through government and various local structures, face the issue of mismanagement, a reality that we cannot run away from. So from the learning perspective, as local and national actors, we need to continue investing in our capacities to deal with digitalization, but also to deal with and managing resources so that we can continue to build trust between when we fundraise resources and also when we're able to be on ground to respond. So also we need to look at digitalization from not a very complicated system. It is as simple as WhatsApp. And then you know that there's a crisis in this community, there's been an over-influx, there's a cholera outbreak in this community, but then how organized are we then to mobilize resources digitally to respond to such and such a crisis or a disaster? So for me, amid this localization, amid this digitalization of humanitarian work, amid this social accountability and response, we need to center the affected communities and the affected persons such that we are more transformative in our response and dealing with the digitalization in humanitarian work. Over.
Thanks, Naomi. Kate has a hand up, and we're not actually sure if you can speak as a non-panelist, Kate. So try and talk, and if you can't, put it in the chat. All on tenterhooks.
Maybe while we're sorting that out, Dana, did you want to maybe say a couple of things about the role of social media in social protection and social assistance in the KRI?
Yeah, I think there's a big problem through the social media because it works from in the social media for the social protection in two different ways. One, some organization and informal providers always use social media to get assistance from other people to support other one. But to prove that they need this assistance to a specific person for example, for health or for any other things, they have to publish the photos and videos, and sometimes it's like a violation of their dignity. It is not good process. The other way, when we start the campaign of dignity, we found many people and mainstream medias and also the lawyers supported us. They always said it is a good step. We need to continue to raise awareness. When we talk to the organizations, we visit them so as not to use social media in that way. Some of them supported us. They signed our pledge and they decide to not post the photos and the videos of the recipient. But the others said that we fill the consent form with them. After that, they publish it. A big problem from this situation, I think there's 2 points. One point, when I obliged to write to sign a consent form, it doesn't mean that it is I agree with that 100%. It means that I obliged to do that because I need the to get the assistance. The second point belongs to the laws, KRI laws and Iraqi laws. there's no mentions about the how to protect people's dignity in social protection system. This is the gap when we mentioned in our final report, in our recommendation is ready to present to the Parliament and government and also UN agencies. As I understood, social media is good to use to make aware people where is the assistant and what are the type of the assistance. But when it used for collect assistance from different people, you cannot monitor it. You cannot assess this process will be transferred to the right person, to the right place. There is no monitors. Maybe these assistance will be utilized to another way, to maybe utilized to the personal needs, not to the public needs. Yeah.
Great, thank you. And I think that's been a key finding, the double-edged sword. So it can amplify voices, but it can also pose some dignity problems. Kate, I think you're able to speak now if you'd like to ask your question in live. Otherwise, I can.
Great. Can you hear me now?
Yes.
Excellent, thank you. Yeah, thank you for this series of really fascinating presentations and discussions. So I'm Kate Bruce. I'm a research fellow at IDS. I work on the politics of social protection. So I'm interested in the challenge that was raised sort of early on about technical targeting competing with local concepts of fairness. This is something that I've worked on in Zambia, which is obviously a stable context rather than crisis, but this was around sort of labour capacity and that importance in terms of questions of fairness and deservingness. So I was just wondering if there are any examples of this in the cases presented. I'm particularly interested in KRI, but any examples would be great to hear. And also if there are, what are the ways in which these local views are aired or addressed, if at all they are. Thank you.
Great. I will give you just a brief overview from the basic perspective, and then Alex, if you have any reflections from IFRC's experience. There's actually a whole section from basic outside of the accountability subtheme that's looking at targeting more generally. It came up so many times because it's such a central issue of the design of social assistance. So KRI was probably the most acute example, whereby since the government had not been able to provide formal social assistance, it was a lot, as Dana mentioned, from local organizations and even informal actors. And they would go through a list, so they would compile a list of vulnerable individuals or families. And honestly, the eligibility criteria between that and, let's say, an internationally designed and implemented social assistance program wasn't so different. So, widows or widowers, families with large families with small children, et cetera, et cetera. But the way in which people were targeted and how they were deemed to be eligible and how that was communicated was very different. So a lot of these local organizations will put together a huge list and they'll work their way through the list as assistance becomes available, because some of them are relying on local donors or whatever it is. But we saw something similar in Somalia, where again, the eligibility criteria weren't necessarily the ones in question. It was more the targeting methodology. And they may have agreed with the proxy means test or whatever kind of targeting approach was used in a more technical sense. It's just that it was very little understood. And when those technical systems were not performing or they were excluding certain people, there was this sense that they were not able to put in question the whole targeting approach. And so what ends up happening is it comes through the accountability channel saying, I don't understand why my neighbor was selected and I was not, or we weren't able to discuss who within the community would need to be selected. And so I would just summarize it in terms of saying the cutoff points that are necessary for these technical targeting of large-scale social assistance programs end up feeling arbitrary when there's more collective decision-making at the local level or more discussion about who to prioritize in difficult situations. So I hope that answers your question. And Alex, I don't know if you have any reflections on some of the stuff that's come up maybe through the Trust Index.
I think your answers can be more perfect, so I don't have that much to add. I mean, obviously, I think we traditionally rely too much on deciding the selection criteria on different, basis, and and variables, and then we really focus on communicating that selection criteria. I was just reviewing before this call or operational strategy for Cabo Verde for the floods there. And again, like, you know, the operations are really going to focus on like communicating the selection criteria. And my question was like, how are communities participating in, you know, designing that selection criteria? How are we involving? And like, I mean, obviously, again, community is a huge word, and who is the community? Who are the different people in the community? And are we involving, you know, vulnerable groups in that participation process, et cetera? So obviously, this is really complex, and it's so context specific, and there's no perfect formula, as much as we would love to have that. And I think, Luisa, your answer there was great for that, because and it goes back to what I was saying about managing expectation. And so I think those expectations need to be managed, you know, before the selection criteria is even communicated, and when it's designed and whatnot. And I think that's why in our community trust index, as I said earlier, across the board, you know, across all countries, the issue around neutrality was the weakest. But I think actually, you know, it said net neutrality, but the issue is really around fairness, right? Because the communities are not involved enough in designing how programs are not just implemented, but how are, you know, who is targeted and whatnot. And so because of that, you know, there's a perception that humanitarian actors are not necessarily fair. And I think that just shows that it is such a large issue that we need to accept that it takes time and effort, and it's not something you can do overnight. And if we accept that, then we need to do it properly. That's the best answer I can give you.
Yeah, and I think your point about neutrality being this kind of humanitarian space, and now it's being very much discussed and contested. For example, the flotilla for Gaza, and political versus not. There's a lot of questions around that, but that idea of fairness is coming up time and again. We are approaching time, and I see that there's 2 questions left. And so I'm wondering if, Naomi, you would like to speak a bit about the differences or challenges. Rachel is actually one of the directors of BASIC as well, and has done extensive work on targeting. But could you talk a little bit about the differences between setting up an accountability mechanism in a crisis or fragile setting versus more stable settings? Because Uganda has all of those settings. And so just a couple of words on that before we close off. And then I see that Noor is also asking about clear examples of community participation in designing and monitoring targeting criteria. I feel like we could have a whole nother webinar on that. But we are seeing a lot more, I would say, what we'd call hybrid targeting approaches, where there's a longer period of community consultation, and then building on what Alex has just said and what Naomi said earlier, just listening in the beginning and then being able to design something that is technically robust for a large-scale social assistance program, but that takes into account local concepts of fairness, how social assistance has been historically distributed. There are a few examples. We tried to list a few in the paper, but it's still, I think, a work in progress. So over to you, Naomi, just to talk about the differences between accountability and fragile versus or conflict versus stable settings.
Thanks, Luisa. I'll start with giving examples to Noor's question. We have the joint action planning approach that we utilize so much, but requires a lot of time in terms of investment, because you're joint action planning with various community leadership and local leadership, and they all have different levels of reasoning and input into the process, which we all need to respect and appreciate. It also involves developing ability or resilience to be uncomfortable, like Alex mentioned earlier. But also we have the coalescing approach to programming, who have strong niches in different areas or different communities that can feed into one, so that the various niches give us a strong accountability structure or mechanism targeting a particular community. Now, speaking about designing accountability structures in a fragile and stable setting. In a stable setting, like for instance, Karamoja's areas of Uganda, it gives you more time and flexibility to quickly engage a wider community in the design process, intervention, but also gives you time for adaptation to inform corrective actions that has been provided to you by the community. But then in the fragile setting, where we are having over 100,000 refugees come in on a daily basis in the community, and where we are having also resistance from the host communities because they feel the actors or people who are intervening are considering more of the refugee community rather than the community, and yet we are equally in crisis situation and the poverty levels cut across. The experience shows there's been minimal community structures to support in social accountability and designing approaches. So we'll utilize the experience from before to inform the intervention strategy. Over.
Great. Okay, Paul, over to you to kind of close the session. I'm going to leave just some points that have come up through our interaction with the colleagues here and the research. And thank you everyone for these great questions.
Great, thank you. And I'm conscious that it's now 11, so my last thoughts should be very, very brief. And we've had a brilliant panel, and we should sort of respect their thoughts rather than do mine. And the points here are what's been emerging from the research that we've been presenting today. I guess to finish maybe on reflecting on Rachel's question about sort of what's different in situations of fragility, conflict and violence. And clearly, you know, in today's challenging aid environment with sort of international aid actors cutting funding, you know, there's a stronger argument than ever for both the need and the sort of imperative for local actors to step up and take the lead, and therefore for accountability is shifting anyway. And so the arguments we've been making for why it should shift are more important than ever. But that's sort of true everywhere. What do I think is different about fragility and conflict and violence is violence, of course. People are facing sort of violence and discrimination, and so accountability is particularly challenging in those contexts. And so I think we need to think more about how we sort of link up accountability efforts with protection efforts, and think about how, you know, the different roles of different actors, how sort of international actors can step back from implementation roles, give more power to local actors, but perhaps play sort of important brokering roles in sort of challenging systems of violence and discrimination, and raising attention to the accountability for those groups that are excluded by violence. And so that's a difficult agenda, one that's going to require shifts in what international actors think about what they should do, and shifts in how we better support local actors to take the lead, as we've been hearing from Naomi. But it's really encouraging to hear about those shifts happening, about the local networks in Uganda that are sort of taking charge of the agenda, and thinking about ways we can step back and enable that to happen from the point of view of international actors. I think is really important. So I've run over by 2 minutes. Apologies for that. Thank you everyone for joining. Do read the research that BASIC has done and that we've been talking about. Do read the excellent initiatives that Naomi posted in the chat from CapAIDS. Do follow the amazing work that Passawan's doing in KRI. Hopefully they'll shift the legislative agenda and enable the accountability to be very different in KRI looking forward. And we'll look forward to following all those events. Good luck to the Red Cross movement as they respond in Afghanistan and elsewhere. And thank you all for your time.
Thank you.